Let's talk about hiking blister prevention and treatment. Now, I have extensive experience with this through Boy Scouts, through my own hiking in Canada and the United States, and also having hiked the 500-mile El Camino in Spain and in France. First of all, let's talk about prevention. The key thing is the shoe that you wear. And so I highly recommend high quality brands like REI, Merrell, Vasquez. This is a Obas, and it's an excellent shoe. Years ago, decades ago, I used to be very old school and wanted full leather tops. As a matter of fact, Vasquez Sundowners, work boots with leather. I wore a pair of those for a decade until the heels just fell off. I just loved it. I polished it with Cordovan shoe polish, and it's just some of the most beautiful shoes you've ever seen in your life. As a matter of fact, my second pair of Vasquez Sundowners I wore on the El Camino, and there's an old rule of thumb that with leather boots it takes 500 miles to break them in, and I thought I had them broke in, but in hindsight I think I'd only went 250 miles, because the first 250 miles of the El Camino did generate blisters, and the second half the leather was like, you know, velvet, and just no problems at all. But in hindsight, I would recommend, if you are carrying a pack less than 10% of your weight, to buy a walking shoe like this. Once again, from a high with what they call soft side, so non-leather. And once again, from REI, Vasquez, Merrell, Obas. And these shoes almost will break in right out of the box, but yeah, I would wear them at least a few months before you took a major hike. Now, almost equally important as the shoe is the socks you wear. So I highly recommend what's called merino wool socks. There are some brand names such as Smart Socks and PhD socks. So have that type of sock on. And a matter of fact, if you're in an environment where your feet sweat a lot, make sure you have 2 pairs of socks every day, so that about noontime you can change socks and put on a dry pair of socks. Now, another little trick that will be tremendously helpful is on certain high stress areas. Put a little bit of Vaseline right here by your little toe, maybe the next couple toes, maybe over here, a little bit on your heel, just a thin layer, and you will find that it just really decreases the friction on those high probability areas to get blisters. And another key thing is if you've walked 4 or 5 days and you are starting to get blisters, or you have blisters, if at all possible, stop for a day, 2 days, 3 days, and just rest your feet. Let your feet and your blisters get caught up. And then finally, as far as prevention, along with having the right shoes, I submit you want to have the right sandals, hiking sandals, and Teva and Keen are great brands. This allows you some degrees of freedom. You can wear your hiking shoes throughout the day, and then in the evening you could wear your Keen or your Teva hiking sandals, and you don't have pressure on the different blister sites or potential blister sites. And you can also do a technique that I used on the El Camino. And on some days I would wear my hiking shoes in the morning, and then at noon or 1 o'clock I would switch to the sandals and hike all afternoon in the sandals, because the latter half of the pilgrimage, the hike was, it was quite hot. Now, on the issue of how do you treat your blisters? Well, let's look at, once again, my crude drawing of the blister. This is a profile of one. Of course, we're familiar with the blisters are going to rise above your skin. And then here's an aerial view. Now, the traditional first aid is that you just wash it with soap and water and leave it alone. If you're in a situation like a weekend warrior where you've got on a 1-day hike or 2-day hike, 3-day hike, and now you're at home, just wear some sandals for a few days or a few weeks. And I've done that. And if you're retired, you have that luxury. Now, if you find that the pressure of what's called the serous fluid in the blister has built up so much that it's very, very painful, then you may have to do drainage for that. And the way that you do that is you simply get a straight pin, and ideally this would be a surgical pin that was sterile, but a good shortcut is you just get an alcohol swab, and you can buy this entire box of hundreds of these for just a few dollars. You wipe it off very clearly. You then would have washed the blister with soap and water, damped it off with a clean towel, and then you don't want to go directly into the blister. Usually you'll find a little bit of skin here, and you want to tunnel underneath, making a hole, and then just gently press down, and the serous fluid will come out. And then you would put a Band-Aid over it. And I do not recommend mole skin or any of those types of products. What I like to use is just get a 4x4 or smaller gauze pad, get some Coach tape, scissors, and of course, once again, since you want your Band-Aid to be as clean as possible, you're going to clean with alcohol swab your scissors. And then I'm not going to actually go through the details of this. It's specific to the size and shape of your blister, but you just cut out from a 4x4, or you could use a 2x2 gauze pad, the shape that you want, and then you take what's called Coach tape or sports tape, and once again with this white masking type tape, you cut out an adhesive tape to accommodate your gauze pad. Place the gauze pad there, put the tape over it, and you are good to go. I recommend you change the dressing at least once a day, or if it becomes waterlogged with additional serous fluid that seeps out, and you change it. Do not use alcohol on the wound site. Do not use hydrogen peroxide. Do not use iodine. Those are all very old school and will cause more damage to the healthy tissue. And in the case of using alcohol on an open wound, it's not like the Hollywood movies from the 1950s. It will set your hair on fire. It will hurt so bad. And it really doesn't help that much. Now, one antiseptic that you might find helpful is to use Bactine. It has a very excellent active ingredient in there for a disinfectant. You probably should also, before you put the bandage on, use some sort of antibiotic, something like bacitracin. Neomycin is fine, but a lot of people are allergic to that, myself included. And like I said, just change the bandage once a day. Now, what happens if you're in a situation, you're hiking the El Camino, Appalachian Trail, the Pacific Trail, you're in combat, let's say, and you got to keep going. You just got to keep going. Well, interesting experience. When I was hiking the El Camino in Lograno, Spain, there was a fellow that we called the blister expert. And he had an interesting story. He was a former Spanish x-ray technician, and he was going out on Saturdays to help the pilgrims take care of their blisters. People wanted to donate money to him, so the next thing, he made it a full-time job. And he had a poster up at a place where a lot of pilgrims stayed, and it was, this many blisters cost you like 10 euros, this many blisters are 5 euros. If you had no money, it's free. So this is what the fella did for a living, was do first aid on blisters. And so he treated my hiking buddy's blisters. I then had him treat my blisters, and then I was very inquisitive and discussed things with him. And I should mention, I've actually had 4 careers. One was as a United States Naval officer. I was a CB, a construction battalion. I got an MBA, Master of Business Administration, and Certified Public Accountant certification, and became a business executive for over 20 years. I taught at a major university for accounting and business strategic planning and management. And interesting enough, at the age of 49, I went to nursing school and became a registered nurse and did 6 years in 2 different hospitals. And I just love wound care. So, you know, I have a lot of wound care experience now. I am totally retired. Naturally, you should always seek out a licensed medical provider, a doctor, for whatever ails you. This is strictly for educational purposes. And the technique I'm about to show you is for extreme situations. Like you said, you're on the trail, the Appalachian or the El Camino, and you got to keep going, or you're in combat and you just got to keep going. So here's what the blister expert in Legrano would show. And I was actually, as I researched his technique, I did find some support in an Army manual, a U.S. Army manual. But here's what he would do. He would take the straight pin, and he would clean it off with the alcohol. He would have the blister site washed with soap and water, and then he would make a puncture here, and then he would insert his pin in and just pull up, or in some cases he would take scissors and clean them off with alcohol, and once he had the puncture wound, he would insert the bottom half of the scissors and make a cut across here. And then he would do it here. So you got, basically, this is cut. Sometimes you cut it here and here. Now, of course, all of the serious fluid is going to come out at that point. But what this allows it to do is you leave the flaps there, but for protection of the blister site. But within a day or two, the flaps are all going to dry up and kind of wither away. And during that time, the base of your blister will heal to a certain degree and fill in with what's called granulation. And of course, you're going to, after you do all of this, you're going to put a gauze bandage over it. You're going to held on by the coach tape. And then once that was in place, then you take the sports tape and you reinforce the whole area. So if you have a gauze tape here, or gauze pad here, and you covered it with some tape, that's the bandage. That's to keep dirt and any germs out of the wound. But you might or will want to put a reinforcing tape over that, so when you put the shoe back on, you don't aggravate the original blister site nor cause additional blisters. And I recommend only using sports tape. Do not use duct tape. Now, duct tape is a great product for lots and lots of purposes, but not for wound care. The problem with it is if your foot skin is thin, like in older people, or it's moist, or you have both situations, the skin is moist and you're an older person, you put that duct tape on it and you pull it off, you may just take all of the skin off with it, or most of it. So you don't want to use duct tape on blisters. Now usually open wounds, such as a blister, will not become infected. But if you see any of the following signs, you have a temperature, there's pus coming out of the blister site, not serous fluid. You see red streaks. To the hand, as you touch around the blister, it's hot. Those are all signs of an infection, and you should immediately, as soon as possible, go see a licensed medical professional, such as a medical doctor. And of course, all of this discussion about blisters is for hiking blisters. If you have burn blisters, that is another sign. You should immediately go and see your family doctor, emergency room, and be treated appropriately for that burn. So, kind of several little techniques on how to prevent blisters, how to treat them when there's not an emergency, and then how to use extreme measures to treat them when there is, sugar has hit the fan and you got to keep going, your feet are your wheels. Be prepared.